This is All India Radio. In the program Spotlight, we now bring you a discussion on health research and infrastructure in India. The participants are Dr. Raman R. Gangakhedkar, public health expert and former head scientist at Indian Council of Medical Research, and V. Ravi Kumar, AIR correspondent.
In a significant infrastructural milestone for India and a boost to the country's health research, Prime Minister Narendra Modi laid the foundation stone for the National Institute for One Health in Nagpur today. This institute will focus on increasing preparedness and laboratory capabilities for identification of novel and unknown zoonotic agents. The Prime Minister also inaugurated the Center for Research, Management and Control of Hemoglobinopathies. In the light of these developments, we are joined by Dr. Raman R. Gangakhedkar.
There are few things which we must remember. We just had a COVID outbreak. Became a pandemic. It was a zoonotic disease which affected the entire humanity. If you look at our own infrastructure we had only one National Institute of Virology in Pune which had that capability to work over newly emerging infectious diseases, especially the viral diseases. But what we required was an institution which looks at One Health. And One Health is a concept which can best be explained by the fact that human health depends on the environmental health, the influence that it would have on people, the zoonotic diseases that could come from the animal side, whether it is wildlife or even the domestic animals that we tend to have, and also on the agricultural and fisheries side. National Institute of One Health was one of the biggest steps that was announced in the budget that Government of India had approved in the very recently. And what it does essentially is lay down grounds for maintaining surveillance, research, and try to come out with novel strategies to intervene on this emergence of these newer zoonotic diseases. And Nagpur perhaps is the ideal place because that place you would also have wildlife sanctuary which is located just around this new institute that is being established right now. You have agricultural university. You also have environmental institute in National NIRI as one of the institutes in Nagpur. So it's one step forward towards developing infrastructure for pandemic preparedness that can arise in future. That's number one. Number two, we also look at not only the infectious diseases. What the Prime Minister also inaugurated was an institute which was to work on hemoglobinopathies. And by hemoglobinopathies, we essentially mean there are certain genetic diseases which are common among tribals. And essentially, if you look at Maharashtra, so what was important was these diseases tend to occur commonly among people living in the regions of Vidarbha. We have one National Institute of Immunohematology, which actually spearheads the campaign against hemoglobinopathies as well, which is located in Mumbai. But in order to ensure that the tribes, and most importantly, a primitive tribe like Madia Gond, which is worse affected with these genetic disorders like thalassemia and hemoglobinopathy, it required both the diagnostic capability, ability to conduct research, provision of right kind of treatment to all these tribals, and ensure that they receive the healthcare which is necessary for them in their own regions, because these are genetic diseases which require a constant support for reducing the morbidity and mortality per se. The third thing which is also important was this is a region which has a large tribal population in terms of proportion. Now in those circumstances, provision of tertiary care, which was something which became important in COVID pandemic, it also is necessary to be provided. And for that, Prime Minister established All India Institute of Medical Sciences in Nagpur, and this institute is supposed to provide all super specialty care. And that's something which will ensure that even the poorest of the poor, the most vulnerable among all the tribal populations, will have access to quality health care and at no cost for all of them. And that's something which is essential to my mind, which will boost the healthcare infrastructure. And it is also important for one to remember that he inaugurated the road. Now, these are important because if you have good road infrastructure, anybody who requires emergency care can actually access that care by ensuring that these centers can undertake quality research. It will perhaps also impact on our future pandemic preparedness, future virus research that might come, or research on hemoglobinopathies that could come by the inauguration of all these institutions today in the hands of Honorable Prime Minister.
So you mentioned that One Health is a collaborative, multi-sectoral and transdisciplinary approach which works at a local, regional, national and possibly even global levels. And you expanded upon that, what One Health is all about, and also about research in terms of hemoglobinopathy. And the Prime Minister also dedicated the AIIMS Nagpur, as you mentioned today, for tertiary care and secondary care, as you mentioned. But universal primary health care is still an area where something needs to be done in India. In fact, just today, the two-day National Health Ministers Conclave on Universal Health Coverage 2022 concluded in Varanasi. So can you share with us what is being done by the government in this field in terms of primary health care?
There are a few things which we need to remember. Now, we have started health and wellness centers across in the country. Now, these health and wellness centers are perhaps the places where people will receive not only care for the primary elements that they would have, but also to maintain wellness, that you don't fall prey to different diseases by changing lifestyles, whether by provision of services through yoga, or provision of services which could fall under Ayush as services that could be offered to people, which are as much popular and acceptable to people. So there is one part which is ensuring that they would have provision of services to health and wellness centers. And the second component, which is also important for us to remember, that Ayushman Bharat is another program where they are ensuring that each individual will be able to access the healthcare services which could actually cost up to 5 lakh rupees for the government while providing. So these services will become free, and that is universal care that is being provided through the government, and the deliberations also reflected upon what else can be done so that we can enhance our capabilities in providing the basic human rights related to health to our population.
So you mentioned the Samriddhi Marg, which is the highway, the expressway that is being phase one of which was launched today. You mentioned roads enable people to access emergency care, but technology also allows healthcare to be provided remotely using what is known as telemedicine. And we have apps like eSanjeevani which have been launched by the government because that allows you to reach people in faraway areas more easily using technology. So what are the further possibilities in the field of telemedicine in ensuring universal health coverage in India?
Telemedicine is something which will ensure that the access for right kind of consultation would be available to each and every individual. There would be these telemedicines actually was something which was used very strongly. The eSanjeevani that you mentioned was a process which was started during COVID pandemic for people having any illness other than COVID at that point in time. But what it does essentially is help the local physician, local healthcare worker to how to handle a person who has come with some kind of symptoms and signs of a disease per se. Now, not everything would perhaps be provided only through telemedicine because you will have to train people to undertake those investigations, those interventions at the other end also. And we may have to move forward, having established this telemedicine and eSanjeevani, which is a free service which the government provides for people. You may have to even think in terms of using these to raise the capacity of the local staff to undertake these investigations.
So just 13 months ago, the government launched the Pradhan Mantri Ayushman Bharat Health Infrastructure Mission for comprehensive healthcare across the country. There was another one which was to expand and build on IT-enabled disease surveillance system. Can you double-click on that for our listeners?
When we talk of surveillance, there are two ways to do surveillance. One is the active surveillance that we do, and the second is we may also have to look at passive surveillance that tends to occur. No, because if you find somebody in a village is having a peculiar illness, you need to report that into the system. Now, that may not be an accurate description of what exactly he is having, but it will at least flag that the person's disease episode needs to be investigated. And this can happen through IT-enabled surveillance per se. Now, I'll put it the other way. We used this approach entirely in COVID very strongly, whether it was for provision of services like vaccine rollout, whether it was to find out the adverse events that occurred after vaccination per se, and all other possibilities tend to revolve around it, because it's just that you need to have a software infrastructure and you may be able to do surveillance very quickly because that the entire data can be entered by the most, lowest rung healthcare worker through the mobile per se, and it can be analyzed at different levels and decision making would be possible. So this is going to be a revolutionary kind of an approach to actually find out the health burden, the threats that are emerging in areas. You will also be able to find out vulnerable areas where different ailments tend to occur, whether infectious or non-communicable diseases, and it will help in decentralized policy making. So at district level itself, or even at a PSC level, he can decide as to which is the area where I need to prioritize my interventions and try and ensure that the focus for subsequent surveillance continues to be intensified in those areas.
Dr. Ganga Khedkar, India is now the fifth largest economy in terms of GDP in the world, and it is growing faster than many other countries right now. But for effective progress in any field, money is required. In 2021-22, India spent close to 3% of GDP on healthcare. But if we see all the other developed countries, the US spends over 16% of GDP. Japan, Canada, Germany spend over 10%. Brazil spends 10%. Even China spends 6%. Cuba spends almost 12% of GDP on healthcare. What are our goals and targets in terms of improving targeted spending in healthcare?
The program tends to aim in increasing healthcare budget, but to say as to how it would happen in what step perhaps would also depend on general economic outlook that is currently prevalent. But I'm sure the way the healthcare budget has increased, the way managed to handle COVID using extra budget to support these entire activities, the way COVID has brought health to the center stage, I'm sure that the increase would happen rapidly because health has become an important issue after COVID pandemic.
In fact, you touched upon that particular aspect, and I believe it's a very critical aspect. While we talked about telemedicine, you talked about capacity of local staff being developed. So what are some of the steps being taken by the government in the field of personnel, recruitment and training in the field of healthcare? Because that can be very critical in providing proper healthcare to the entire population.
There are two things which are also happening. If you actually look at what the government has done, is ensure that there are bridge courses, because it knows that the number of allopaths that we have continues to fall short of the numbers that we would ideally require in terms of the population size to which we tend to estimate. Now, if we don't have those many allopaths per se, the best short-term approach can be that you take Ayush practitioners, train those Ayush practitioners, giving them bridge course, and ensure that they are given appointments and are treated as equals to allopaths at every level of healthcare centers, whether it is health and wellness center or whatever. And by that, you not only provide a holistic approach towards health, you would also ensure that the gap that tends to exist in terms of the HR at the primary health center level or in the rural areas is bridged to a larger extent. The second approach is a long-term approach, where the government has decided that each district would have a medical college of its own, so that even those medical colleges, it is expected, will perhaps have postgraduate courses at district level, 4 major specialties like medicine, obstetric gynecology, then surgery and pediatrics. By that, you will ensure that these people are more likely to stay within their own district. But that would be a little long-term goal because it requires almost 7 to 10 years of time.
Dr. Ganga Khedkar, thank you so much for joining us on this program on All India Radio.
Thank you.
You were listening to a discussion on health research and infrastructure in India. The participants were Dr. Raman R. Ganga Khedkar, public health expert and former head scientist at the Indian Council of Medical Research, and V. Ravikumar, AIR correspondent. This program was produced and presented by the News Services Division of All India Radio. You can listen to it on our mobile app, News on AIR. This program is also available on our YouTube channel, News on AIR Official. You may email your opinion about this program at airnsdtalks at gmail.com.